claims of death panels, a government takeover, socialism. From the start, the Affordable Care Act has been a flashpoint. But after surviving a Supreme Court challenge and a presidential election, most people assumed Obamacare was here to stay. Now, though, the problem-plagued rollout of the federal insurance exchange has raised new doubts about the law and given the media plenty to talk about.
President Obama reeling over the disastrous start to his signature achievement.
The Obamacare sign-up falls short by 80%.
He admitted today he overpromised and was underinformed.
Mr. Obama expresses regret and rolls back part of Obamacare.
The Obamacare crisis and the White House in retreat.
The problem? The president's proposed fix may not fix anything.
All right, well, you'd be hard-pressed to find someone better equipped to discuss Obamacare than my next guest. Jonathan Gruber is an MIT economist who helped craft the Affordable Care Act and was also instrumental in writing the Massachusetts health care law. Welcome, Jonathan.
It's good to be here, Emily.
Every night it's like that on television. Is this thing unraveling, or is it just finding its way?
It's just finding its way. It's really too early. Once again, we can look to Massachusetts for a parallel. In Massachusetts, the first month that people could pay to enroll in our plan, 123 people did. By the end of the year, it was 36,000. Basically, people wait till the last minute to sign up for things. That's the nature of folks in something like this. The last minute in this case is really March 31st, when the individual mandate becomes effective. And that's really the key deadline to keep an eye on.
Did we have these kinds of glitches in the rollout of the Massachusetts Healthcare Connector?
We did not have as big glitches. There were some glitches. I think just generally, it just wasn't under such a high-pressure environment. You know, it's funny. This 123-person number I went back and looked up about a month ago. Till I looked it up, I never even knew that number because we just didn't pay that much attention to what was going on the first month, the second month. We knew it was a longer process.
In terms of the website itself, though, I was reading a lot of information on it today. They knew, the technicians, the tech team, the support team, they all knew it wasn't going to work. And yet, you know, the powers that be said, we can't delay it because it'll seem like, you know, give the Republicans more fodder. Was that a mistake?
I think it's really hard to tell because basically working and not working, it's not a 1-0. There's many aspects to working and not working. For example, take the shopping experience versus the enrollment experience. Enrolling you can do over the phone. You don't need to be on the web to do that. But shopping you really need the website for. So maybe they thought the shopping would work, even if the enrollment didn't, then that would be okay. It turns out they were wrong, and even the shopping didn't work very well.
When you hear people say the president lied about this whole, if you like your plan, you can keep it, was that a lie, or did he not know?
I think it was basically an overstatement. What the president could have said is, by and large, if you like your health insurance, you'll get to keep it. Or if you like your health insurance and it's a quality product, you'll get to keep it. There's a very small number of Americans, by my estimate, about 2% of the population, who have these substandard policies who will be asked to buy more generous insurance. Meanwhile, there are 10 times as many people who will be benefiting in various ways from the law. So I think he just sort of meant it generally and fortunately said it too specifically, and that led to the criticism.
Okay, on those junk policies, if I want to pay a high premium and not get very much for my money or however it works and just get covered on a few different things, catastrophic illness or something, what's wrong with that? What's
wrong with that is a couple of things. First of all, that presumes you know what you're getting. Many people are paying money. They're buying a policy that, for example, says we'll pay the first $500 a day in the hospital. They say that sounds great. They don't realize hospital stays are $3,000 a day and they're on the hook for the rest. So the first problem is people might not know. The second problem is when those bills come due and they can't pay, that becomes uncompensated care, which the rest of us pay for. So it's not just a cost to them if they don't pay those bills, it's a cost to the rest of society. As a result, society has a responsibility to make sure people have comprehensive health insurance.
Okay, and along those same lines, if I have a 27-year-old kid who no longer qualifies on my insurance plan, and that kid wants to, just wing it for a while because they're young and healthy, what's wrong with that?
What's wrong with that is the same thing, which is that two things. First of all, that 27-year-old may not be sitting back and doing the math correctly in terms of actually there could be very cheap policies out there for him that protect him against catastrophe, which he might want. And second of all, if that catastrophe does strike, he goes to the emergency room. That's a cost that's borne by the rest of us.
So you're not worried about this at all?
I wouldn't say that. My worries are purely political. Yeah. My worries are not substantive. I think the substance of the law will work. Never in our nation's history have we had such a large law where we piloted it first, as we did here in Massachusetts. The substance of the law is fine. The website will work. It's going to be fine. My worries are political, which is can people be patient enough and understand that this is a process we measure in months and years, not days and weeks.
Has this been so damaging to President Obama that, in a sense, his presidency will forever be tainted by this?
I think the short attention span of the American public works to his advantage here. I think a year from now, when the law is working, it will be long forgotten. Remember, the Medicare Part D program, which is now a wildly popular program providing drugs to seniors, was actually less popular than the Affordable Care Act right before it was enacted. People forget pretty quickly when things start to work.
And what about that March 31st deadline? I mean, right now it seems like a long time away, but as soon as the first of the year comes and goes, it'll be boring right down on us.
That's a huge deadline. It's critical that the systems are working well, that once again people can enroll over the phone, but we must have the systems working well for them to shop effectively on the web. Absolutely critical. If that's not working by March 31st, then we have a real crisis.
Have you tried going on the web and doing it yourself?
I basically stick with Massachusetts, where our website's working pretty well. We've had a few glitches of our own as we're trying to convert to the new federal website. It turns out it's really hard. So I have a friend who worked for IBM who said to me, look, this just always happens when you roll out websites. It's just hard. And I think, unfortunately, currently at the federal level, it's under such a hot glare of a spotlight that it's gotten a lot of attention.
All right, we'll have you back March 31st, see if you're born out
Sounds
to be
good.
true. John Gruber, thanks so much.